My name is Mary and I'm 29 years of age. I'm going to speak a bit about chronic pain and how that impacts my daily life, and then I'm going to move on to acute pain and the journey of managing acute pain and how it impacts my life as well. So starting with chronic pain is the kind of everyday niggling pain that you get that there's not much you can do about. So for me personally, I tend to get chronic pain in two places, my hip and my knee. So as you can imagine, they're both in my legs, so they affect my mobility and my ability to move around, to walk around and so on and so forth, to do things like dancing, go to the gym. All of these things are impacted by this chronic pain that I have. I guess the pros and cons, well, there's no pro, but managing the chronic pain is somewhat easier simply by virtue of the fact that it's something that you learn to live with because it's an everyday thing, or almost everyday thing. You learn how to manage your pain, how to go through the day without taking so much pain relief and so on and so forth. But because it affects my mobility, it does impact. So for example, I live just outside London, but I work in central London, so I have to commute in to get the tube into work. And the tube can be very packed. If you've ever been on the tube in the first thing in the morning or in the evening, you'll realise there's a lot of people, so you have to stand at quite in uncomfortable positions, and you're not always guaranteed a seat. Things like that, I guess the everyday person is fine, but for me that causes a lot of pain. But as you can see, I look fine. I don't look visibly ill. So people may not understand that on the tube. And that can be quite frustrating a little bit. There are badges that TfL hand out which say, please offer me a seat. And I have one of those. And the rules of the badge, it says that you don't need to explain to anybody your condition. But in reality, you'll find that that's quite often just not the case. I was speaking to somebody in my family recently about commuting into work and explaining how painful it can be going into work on the train and the tube. And they advised, oh, why don't you just use the badge? And I said, well, I do have a badge, but if you get onto a train or onto a tube and all the seats are already taken, people tend to see the badge and they see a girl who looks young and looks able-bodied, and they're less likely to offer up their seat. I think in most circumstances, people don't offer me a seat than those that do. And this person admittedly said, well, yeah, you're right, because if it were me and I was sat down and I saw somebody who looked like you with the badge on, I wouldn't offer my seat because you don't look convincingly ill. So kind of managing that on a day-to-day can be quite difficult. In terms of acute pain is the very, very sharp, sudden attack pain that sickle cell patients get, which we call a sickle cell crisis. I would say it's spontaneous, but that seems like such a beautiful word for a horrible experience. It can happen at any time. Sometimes you kind of know that a crisis will come on because of the way you're feeling, but a lot of the time you don't. I recently got on a plane and I was fine in the airport. I was fine getting onto the plane. I was fine when we took off, but by the time that we landed, I was in full sickle cell crisis. And if I had known I was going to have a crisis, trust me, I wouldn't have got on the plane. So these things can happen. It just comes on suddenly. And the journey that kind of puts you on, firstly from the psychological impact of going through the crisis all the way through to managing the crisis through to the end of it, can be quite distressing. So you have to imagine it can be very embarrassing if you fall into crisis in a public place, which unfortunately seems to be the common occurrence for me. I can recall situations where I've been on a train and fallen ill and have tried to kind of make my way off the train into the station and sit down at a bench and call paramedics, but everybody loves a show, and the moment people see, I don't know, paramedics or their bright uniforms or something's going on or somebody's on the floor or somebody's curled over, everybody's peeping over, and I totally understand everybody loves a show, but you have to remember it's not a show. This is my life. I have to deal with this on a constant basis. More recently, I was at a party and I fell ill towards the end of the party, and the ambulance come, and then you have people, I guess naturally because it's a party, people just assume it's because I'm drunk, so you have people yelling out, oh, she's so drunk, she can't handle her alcohol, etc. I don't drink alcohol. It can be very embarrassing, and having to go through that experience every single time I fall into crisis publicly is quite distressing, you know. It can hurt, and dealing with that's kind of psychological thing at first is quite a challenge. And then from there, say you call the ambulance, so dealing with the responder at the other end of the phone, who fortunately sometimes they know what sickle cell is, and that's great, but sometimes they don't know what sickle cell is, and that can be quite an annoyance. So I can recall a situation where an ambulance was called and they were told that I had sickle cell anemia, and when the paramedic arrived, they said, oh, so you've got anemia and you've been sick. So they were quite annoyed at the fact that they had been called out for this thing that did not seem or sound to be an emergency, only for me to be in excruciating pain and have to then explain, firstly, it's sickle cell anemia, this is what it is, this is how it impacts me, this is what I need, etc. So kind of dealing with that kind of first response can be quite difficult. Then you get the paramedic who comes along, or the paramedics that come along, and some are great, they know what sickle cell is, they give you the Antonox. If they have the so for my pain care plan, I am on diamorphine, but they tend to only have morphine, so they can give you the injection, but for some they're not on that, they're on different medications, so they may not have the pain relief relevant for that patient. So kind of managing the pain in the ambulance while you get from where you are to the hospital can be quite difficult. Some paramedics are fine, but some paramedics don't know what sickle cell is again, and you have to say and explain, well, I have sickle cell, my care plan says this, I need morphine, and they're like, oh, morphine, that's a bit much. Have you tried paracetamol? Have you tried ibuprofen? If I needed paracetamol, ibuprofen, I wouldn't have called 999. So kind of dealing with that whilst being in pain, you have to remember, can be quite frustrating. So it's not like now where I'm okay and I'm explaining, oh, well, I'm in pain, this, that, and the other. This is, imagine being in the most pain you've ever experienced in your life, and somebody's saying to you, oh, have you tried paracetamol? The average person is going to get frustrated. So you can imagine how difficult that journey can be, that journey into hospital, particularly if you are denied adequate pain relief and you're just given the bare minimum because the paramedic doesn't know what sickle cell is. And then from there you move into A&E. And A&E is a weird and wonderful world where medical personnel are exposed to all sorts of dramas and traumas, which I understand. And I guess in A&E there's all sorts of injuries, and naturally as a human being, I guess if you see somebody who has, I don't know, a pole impaled in their leg because they had a car accident, and there's blood dripping from their leg, you can visibly see the fact that they are in pain. If that person starts screaming, you're going to sympathize with the person because you can physically see their pain. But somebody with sickle cell, there will be no blood dripping, there will be no pole impaled, but they are in the worst level of pain. And for me to describe the pain, the only way I can do that would be to say, if you just imagine a bone in your body, any bone, and you just imagine there to be little people inside of this particular bone, and each of these little people have daggers or knives or something of that sort, and they are trying their best to work their way out of your bone. So they are pounding on your bone at different paces, in different rhythms, at different strengths, to get from inside your bone, out of your bone, into the blood, out into the skin. They're digging, stabbing away to get out. That's the only way that I can articulate the pain. So it's very, very, very painful condition, and just because you can't see the pain doesn't make it any less real. So just when you're in that kind of environment, you have to remember how painful, and this can be in any part of the body. So I can have a crisis in my little finger, or I can have a full body crisis, or a crisis in my head or in my jaw. It can be anywhere where there's a bone, there can be a crisis. So that's practically the whole body. So it's quite a trying situation to be in when you're in painful crisis. There are other types of crisis, but for the purposes of this, it's just focusing on the painful crisis. So you get to A&E, and oftentimes your care plan will be made available to the A&E professionals, and they can administer pain relief in accordance with your care plan. But you may end up in a situation where you're at a hospital that doesn't have access to your pain care plan, or you may end up in a hospital where the A&E staff are not well versed on sickle cell, and again, similar to the experience with the paramedic where that happens, you're not offered adequate pain relief. You're given, I don't know, maybe a bit stronger than paracetamol, maybe the codeine or the hydrocodone, and these things are okay, but they don't deal with the crisis. And you have to remember, the longer that this crisis goes on, the more potential complications and long-term effect complications can happen in my body or to any other patient. So it's very important that the crisis is attacked and adequate pain relief is given as soon as possible. And then from A&E, you move into hopefully a ward that specialises in sickle cell. If you're in an area where there's high ethnic minorities, the chances are that the hospital will have a haematology ward, and staff will be aware of sickle cell, and they'll be able to administer care accordingly. But if you're unfortunate enough to be in a scenario where there aren't many people with sickle cell, the chances of there being a ward dedicated to sickle cell is very slim. So you may be thrown on any ward, the ward that seems most applicable to the issues that you're putting forward, can be another issue. So you could end up at, say, I don't know, let's say random ward A, and random ward A, the staff are not well versed on sickle cell, and they're not given the adequate pain relief, and the pain is exacerbated because the adequate pain relief isn't given. So it can be quite an annoyance to be constantly given drugs, and you know they're not working, but if you don't take them, it's kind of like you're in a can I say a hostage situation? You're being held hostage to it to some degree. So you're in pain, you know you're in pain, they're offering pain relief that isn't effective, and you don't want to just take tablets or take drugs for the sake of taking drugs. I'm sure most people don't want to take drugs for the sake of taking drugs, but you're being told that, well, if you don't take this, you can't get this anyway, or you haven't tried this, so how do you know it's not going to work? I know it's not going to work because I'm 29 and I've had multiple pain crises, and I know the level of pain I'm at, and I know the level of pain relief I require. So kind of being, I guess, held to ransom by the fact that you know your condition and others don't, and kind of getting that message across can be quite difficult. If you're fortunate enough to be in a ward where they do understand sickle cell, chances are that they will then administer pain according to your care plan, and hopefully the pain will go down. And if it doesn't, assess different ways of attacking the pain, assessing trying something new or trying different things. I've had experiences of trying complementary medicines or trying reflexology, I think they call it, and things like that to try and attack the pain from different ways. And multiple hospitals offer different services, and that's also quite helpful along with the pain relief. So yes, it can be it's quite a journey, I guess, managing pain in my life on a day-to-day basis, and then the extreme circumstances, but working collectively as a team with medical personnel, with my family, friends, etc., I'm able to live a relatively normal life.